Welcome to the Dr. Suzette Glasner Podcast. Today, I am thrilled to be joined by Beverly or Bev Aikins. Bev is a practicing nurse in the field of addiction, mother of 2, and grandmother of 6. Just a couple of months ago, Bev not only celebrated her 10th year in recovery, but she became the first person to have her recovery formally celebrated in a ceremony at the White House, an event that was both envisioned and realized by her son, Vice President J.D. Vance. J.D. Vance's book, Hillbilly Elegy, and the movie starring Academy Award winners and nominees Glenn Close and Amy Adams tell her story from the perspective of a young boy who's being raised in a chaotic environment with an addicted mother. Today, we'll hear that story told through Bev's eyes about the experience of opioid addiction, which we know has taken hundreds of thousands of lives in recent years, and the gift of a rewarding life in sustained recovery. So, Bev, thank you so much for joining me today.
Thank you for having me, Dr. Glasner.
So, why don't we just start by talking a little bit about your background, a little about where you grew up and what your upbringing and family life were like?
Well, I grew up in Middletown, Ohio. I'm the middle child of 3. My growing up years were pretty chaotic. My dad was an alcoholic. He was really abusive to my mom, not to my brother, my sister, or myself, but definitely to my mom. And when I think about my childhood, I think of chaos, I think of abuse, and I don't really remember a lot of it, which I know is odd, but I talked to my sister who remembers everything, and I sincerely don't remember some of the things that she says happened.
You know, it's not that surprising because a chaotic environment with an abusive father, even if he wasn't directly abusing you, is very traumatic. And the way that our brains process trauma, it can be different for every person. Some people have memories that they can't get out of their head. And for some people, that can lead to PTSD type symptoms where they wish they could forget. And then some people experience a little bit more on the numbing side, kind of a numbness, and those memories can be somewhat suppressed. And it sounds like maybe that's how it's been for you.
I think definitely I'm the memory suppressor type.
That kind of corresponds with the tendency to move towards a numbness or a feeling of numbness that you can impose yourself with substance use or just our psychological defenses where you kind of block memories out.
Makes sense.
Well, what do you remember?
I remember there were a couple fights that were really bad. One in particular, Dad came home drunk and was calling Mom all kinds of bad names and tried to physically put her in a washing machine. And I called the police because she was saying, "Help me." And the police came and I got in trouble for involving outsiders. And that just really messed with my mind. And I remember telling my mom, "I thought he was going to kill you." And she said, "He wasn't going to kill me. You overreacted." So from that point on, I just learned to let it happen and hide or just not be around.
That's a really confusing message for a kid.
Very.
Trying to protect your mom. And your mom, it sounds like she was trying to protect him.
She did. I feel like she was a huge enabler of him. And for the record, he did get clean and sober. So my kids, who are now 45 and 40, never seen him drink. My sister and I would actually tell stories or say things about him when he was drinking, and my kids could not believe that was the same man.
What prompted him to get sober?
I know I was pregnant with Lindsay, and I had went to his house, and he tried to reach out and touch my stomach, say something about this little baby. And I did say, "You're not going to have anything to do with this little baby's life. You're not going to screw up her life." And he decided to get clean and sober. And I don't know if it's because I wanted him to, but he did. He did succeed. And he went to treatment one time, and that's all it took.
Really?
Yes.
He was a very severe alcoholic, though, from your
Very
description.
severe. So I was not a nurse at the time, but I kind of had a little bit of an ego and thought I knew everything. Mm-hmm. And my mom had called and said, my mom and dad were separated but not divorced. And she had said, "Your dad's going to try to stop drinking, and I'm going to have him over here in case anything goes wrong." And so I went and got all these vitamins because I thought, well, we'll just give him vitamin supplementation. And if he does have DTs, this will help. And of course, I didn't think of anything about getting benzodiazepines. I just was thinking of the vitamins. And he said there was something crawling on him. And then he didn't know who my mother was. He looked at my mom and he said, "I don't know who this lady is, but she's awful nice." I looked at my mom and I said, "This isn't good." And so We did end up calling 911. He did get admitted. He did have some pretty severe DTs. And then after that experience, he went into treatment.
Wow. So it sounds like he might have been heading down the path towards Wernicke-Korsakoff or Korsakoff syndrome.
Possibly.
If he was getting confused about who your mother
Possibly.
was. Either that or he was psychotic at the time from the DTs. But it sounds like he stopped just in time.
Yes. And he was such a good guy. I adored him. He was so funny and he was so good with my kids and my older grandkids. He was pretty amazing.
So you had a close bond with him.
Yes.
It sounds like. And that was maybe partly why you looked out for him a bit as well as your mom.
Maybe. I feel like I know there at the end, my mom had pretty much had enough of him and wasn't enabling. So maybe I did step in and enable him a little bit.
How?
Made excuses for him, thought that because he worked and provided, he was entitled to have a drink, to unwind, although that's not really what he did. He drank to get drunk, and he did have some legal problem. He had a few car accidents, a few hit and runs. He had gotten in trouble at work, which was huge for him because he was all about his job. And I think getting in trouble at work was possibly what sent him into wanting to get clean and sober.
And it sounds like your mom modeled enabling, even if that wasn't what she was meaning to do. So you might have partly learned some of the enabling behavior from watching her sort of protect him over the years, do you think?
Yeah.
He was Papaw, right?
Papaw, yes.
Yeah. And your mom was Mama.
Mama,
Okay.
yes.
Tell me a little bit about Mama. It sounds like you were close to Papaw. Were you close to Mama? What was she like?
I was close with both of them. I feel like I was closer to my dad, but then when my dad passed, I realized how strong my mom was, and she literally held everything together. She would have done anything for any of us at any time. She was all about family. Anybody who knew her knew that. She was a little rough around the edges. She always carried a gun. Cussed like a sailor, cussed a lot. My kids adored my mom. They just think she's everything. And she really was. She really helped a lot with both of them.
From what I know of Hillbilly Elegy, it sounds like she had a pretty significant role in their lives and might have been like a real source of stability for them when things weren't going so well for you.
Yes, yes. And I've been married and divorced 5 times. And in between every marriage, we moved back in with Mama. So that was their home base. They knew that Mama's house was going to be there, and if they needed a place to go, they could always go there. And that was their safe spot.
Yeah, it seems like it was a real buffer for them.
Yes.
Yeah. Now, there was this side of Mama who was super tough, and I know there's a scene in the Hillbilly Elegy movie where she's had enough of Papaw's drinking and she sets him on fire. Can you tell me a little bit about what happened there?
Well, that's one of the incidents that I don't remember. But what I do remember, and my memory is different than my sister's. I do remember him coming home drunk and passing out on the couch, and Mom poured lighter fluid on him and lit him on fire. And in my memory, I used pillows and put him out. But in my sister's memory, she says she's the one that put him out. So I don't know, but I just know that one of us put him out. And I know the next day he woke up and said, my eyebrows are singed. And Mom said, well, you fell asleep with a cigarette and you also burned the couch up, because the couch, of course, had to be thrown away. And that was all there was to it.
Oh, he never knew.
He never knew.
How old were you and your sister around that time?
I think I was between maybe 10, 11, and my sister would have been 8 or 9, because we're 20 months apart.
What was your feeling towards Mama after that? Was it positive or upset with her?
I don't think either. I just felt like it was something that had to be done. I know there was another time where, this is very personal, he wouldn't give Mom any money, and we needed to eat, we needed school supplies, we needed whatever. And I remember he passed out on the porch in one of the rocking chairs, and Mom slit his pant pocket to have his wallet drop out. And then when he woke up, he said he was robbed. And she just said, well, I guess you were. But I just felt like it was survival. She had to do what she had to do. And I don't think I had a positive or negative feeling about anything either way. It was just, it had to be done. I know that's warped, but that's just how I felt.
There's an element of survival in the
Woven
through the story.
Yes.
If he had known that she had set him on fire, what would he have done?
He would have hurt her physically.
So that's survival.
Yes.
And if she had argued with him further about getting his wallet or about him giving money, something similar?
Yeah. Because he didn't really need a reason to hit her. So if he had a reason, I don't know how far he would have taken it. But none of us ever gave him a reason. We just did what we had to do and forgot about it.
So in a way she was afraid of him, but in a way she wasn't afraid of him because she could do some really tough things.
If you asked her, she would say she was never afraid of him. She would say she needed his income for us kids. So that's why she did what she did.
What did he do for a living?
He was the foreman of the weld shop at Armco Steel, which then became AK Steel, which is now Cleveland Cliffs. It's changed names a few times.
Oh, wow, but it's still around.
Yeah, still around, but I think it's completely different than what it was back when Dad worked there. But I know he loved being a welder. He loved being the foreman. He was good at it. His crew loved him. You know, he was all about work. That was his thing.
And the financial hardship where he wasn't giving money to your mom or there wasn't enough money for the family, was that tied to his addiction? Or?
Yes.
Okay. Was spending it all on booze?
Spending it all on booze. And he drank in the bars. He didn't come home and drink. He was a bar drinker. And it's expensive to go out and drink in bars. I know it is now. I imagine it was back then too. But when you get off work and go drink in a bar until you couldn't stand up and come home, that's where all of his money went.
So the financial issues must have gotten a lot better after he went into recovery.
Yes.
Yeah. How old were you then?
I was 18, and him and Mom separated and lived in separate places. They never divorced, but I do know that both of their financial situations got much better, and they became actually very good friends.
They never got back together.
They never got back. No, never.
It was just too much wreckage from the addiction.
Yeah. And I think by that time, they were actually just really good friends. And I think Mom really cared about him. And I know when he passed, she made all the funeral arrangements. She took care of everything. And he's buried in her family's cemetery in Kentucky.
Oh, really?
Yeah.
Did she separate from him before he decided to stop drinking or after?
He separated from her because he met another woman.
Okay. Was that drinking related?
Yes.
And did he stay with her?
She actually died. She passed away of a heart attack. And then he met another woman, and Mom actually became very good friends with her. Actually, the kids ended up loving her. Her name was Karen, and she was younger than Dad, but she would come over to the house and play cards with Mom. And Mom she just really had a loving heart, even though it didn't seem like it. She really did.
Well, yeah, she would have to in order to make peace with his separation, become friends with him, and even befriend his future partners with all the history that they had. Wow. How did that whole separation and him finding another woman and all of that during the marriage, how did that impact you?
I don't believe it did. I wanted Mom to get a divorce, but she did not want to get a divorce. She said that she would lose her health benefits, and she didn't. And nobody really argued with Mom once she said, this is what I want, this is what I'm going to do. We just all said, okay.
So there was a lot of financial dependency that was keeping her in the marriage even when it was not healthy and she maybe didn't want to be there.
Yes.
Yeah. Did that sort of model of how you grew up affect your choices later, do you think, in the relationship department? I know you said that you've been married 5 times.
No, I know that my first husband was my high school boyfriend, and he's a very good man. I just think I couldn't settle down. I don't know if it affected my choices, and I think out of all of my husbands, he was probably the best. You know, he was a good person. He's still a good dad to Lindsay. And from that point, my picker kind of went downhill. Each one got a little bit worse.
So why do you think that was? Was that tied to your addiction? Or
I think it was. I definitely was attracted to the men that I knew had access to drugs and liked to party. And that was my number one requirement. I didn't really, care if you had a good job or whatever. It's just, you've got access to drugs. Well, we'll probably get along great. That's just kind of who I went for.
So when was the last time you were married?
The last time I got married, I think it was 2006, 2007. Mm-hmm. And we lived together for a couple years, and we were separated, and then we eventually got divorced. But it's been a long time, at least 15 years.
What's your sort of stance on relationships for yourself right now?
They're not for me. I think it would break my kids' hearts. And what I've learned about myself in recovery is that I'm very selfish. I don't like to compromise. And when I want to get up and go, I want to get up and go. I don't want to check with a person and say, hey, I've got to do this weekend. Is that okay with you? I just want to decide if it's good for me and do it. And I have a dog. And that's basically who I'm committed to right now is my girl.
And you feel fulfilled.
I do.
Yeah.
I do.
You have your job, you have your pet. Are you worried that if you were to get into a relationship, it would lead you down a negative path with respect to addiction? Or are you feeling really solid?
I mean, I feel really solid in my recovery, but I also know that every time I've gotten into a relationship, I've ended up getting high. And maybe it's part of that I don't compromise very well and that I get very stressed out with relationships and dealing on such a personal level with a partner. I don't want it. I'm completely happy. I'm sorry you're uncomfortable that I'm alone, but I am not uncomfortable. This is my choice.
And it's a perfectly legitimate choice. It's like each person creates their path, and this is your path right now, is relationships are not a part of it. One question I have is, how do you find fulfillment in other relationships? Who are you close to in your family? Like, what is the role of your family in your life?
Well, I'm probably the closest to my grandchildren and my daughter because she lives close to me, and I talk to her a lot, probably every day. I'm not as close to my son as I'd like to be, but I think that's because he's just so busy. My sister, I talk to her, and then I have a really good friend in recovery. Her name is Leslie. I also talk to her every day, and people I work with.
Well, that's plenty of
That's enough for me.
No, yeah, exactly. That's where you're finding your relationship fulfillment. Let's talk a little bit about your educational background, how far you got in school, and well, let's just start there.
Okay, so I have an associate's degree in the science of nursing. My goal before I die is to have a bachelor's degree, possibly a master's degree, but just right now I want to settle for a bachelor's degree. I have restrictions on my nursing license, so I'm considered an encumbered nurse. For that reason, I can't pursue a higher degree in nursing. Now, I could get a degree in allied health or substance use counseling, but I don't want that. I want a degree in nursing. That's my passion. It's what I believe in. So I am hopefully getting these restrictions lifted so that I can get that bachelor's degree.
That would be amazing. And those restrictions were imposed in some way in connection with your addiction?
Yes.
What happened there?
Because I am a drug-addicted nurse, and I did get in trouble for stealing drugs from the hospital. I was on a contract with the Ohio Board of Nursing. Part of my contract was I had to submit to urine drug screens at their request and do some other things. I had to take continuing education units. I was officially suspended for a year, but I completed all that and came through that. And in Ohio, they said that after you get off of your contract, you are required to wait 5 years before you can submit to have all of your restrictions removed. But I'm 64 years old, and by the time my 5 years are up, I'll be 68. And I just feel like it should be based on an individual basis. And, I've spoken with them. I've went up and had a meeting with them. I've agreed to do a whole another year of urine drug screens. I basically want these restrictions lifted so I'm not encumbered so that I can go back to school.
10 years in recovery is pretty solid.
That's what I think.
Yeah.
That's what I think.
Yeah. What brought you into the field of nursing?
Well, I was thinking about getting my third divorce. And I knew I wasn't happy, and I had these 2 little kids. And I knew at the time I was working in menial jobs. I would think I was a cashier at a gas station. And I knew that I needed to do something to provide an income to take care of these kids and myself. And I didn't want to be like my mom. I didn't want to have to marry a man to provide that income. And you can become a nurse in 2 years. You can get your associate's degree in 2 years. And I felt like that was the right avenue for me. And it was, because I absolutely loved nursing. That was definitely my calling. And so that's it.
Now, was there any role model for you? It sounds like you were finding your way on your own career-wise. Anyone inspire you in the process?
My mama, Mama Blanton, who lived in Kentucky in a holler, she was diabetic, and she had a nurse that came in, a home health nurse, and her name was Mary Jane. And I remember every time Mary Jane came, everybody would clean up their language, and there was just so much respect for that nurse when she came into the house. Wow. And as a little girl, I remember thinking, I think I want to be like Mary Jane. So I think she inspired me, and she took such good care of my grandma. So I think she definitely is probably who inspired me to become a nurse.
That's amazing. Well, that's something you just don't forget.
No.
Now, were your parents supportive of you pursuing education and getting a degree?
Not at first. They were of the thought that, if you're a female, you just marry a nice man and he takes care of you. And I knew that wasn't in the case for me. I just knew it. So once I got into it, they became very supportive. I just told them I'm going to go to school. And my mom, I still remember when I was studying for the NCLEX, which is the test that you take at the end of your schooling.
Yeah.
I remember my mom quizzing me constantly. And when I didn't get something right, she would say, "You know this. Why did you answer it that way?" And I'm thinking, here is this woman who has a third grade education, who is probably the smartest person I've ever met, but maybe didn't have the confidence to do it, because she probably would have made a much better nurse than I have.
So.
But we would do the NCLEX questions and she knew all of them and she didn't even have to look at the answers. And, that's one of my fonder memories of me and my mom, just the two of us studying.
Yeah, sounds like, okay, in her way, she did support you along the way.
She did, yeah.
To the end, even though it wouldn't have occurred to her to propel you in that direction.
Right. And I do remember at my graduation, every time they named a person's name, there was a little bit of clapping. And when they named my name, everybody heard my mom. She's up in the stands and she yelled, "Hell yes!"
She's a vibrant woman.
She was. Yes,
for better or worse.
Yeah.
You're going to hear her voice.
Absolutely.
One way or the other.
Yes.
So you're close to your grandchildren. And when you said you're not so close to your son right now because he's so busy, is that a change from before, that now that he's become so busy, you're a little less close, or you feel like that lack of closeness has been there?
We're probably still as close. We just don't talk as much. I mean, I know he's busy and the kids are little and they're very demanding, and he does have a very demanding job right now. So I try to not be one of those pesky moms that's call your mother.
Right.
I do every once in a while. And then every once in a while, out of nowhere, I'll just get a text that says, "I love you, Mom." There'll be no context, no nothing, which brightens my whole day. But I talk to my daughter about every day.
Well, it's interesting about the "I love you" text. In his book, he describes his relationship with you as complex. There's an implied complexity, right? Like you're getting these loving texts, but maybe you're not as close as you would like to be. What's your kind of take on the relationship?
I remember reading his book and I was heartbroken. There's a line in the book, I don't know what page it's on, but it says, "My mother, a woman I wished I'd never met." And I had no idea that he felt that way. And I've tried to reevaluate this, and him and Lindsay, that's my daughter, they did have a pretty messed up childhood because of me. But in my mind, I'm thinking, well, your childhood wasn't as bad as mine. You didn't have to flee in the middle of the night and go sleep in the backyard because your dad was going to beat the crap out of your mom. But I have to realize that they were just kids and I was the monster in their life. I think the book did provide a lot of healing because we were able to talk about things that we hadn't talked about. And there were a lot of things that I made assumptions about that I was completely wrong. So I agree with him when he says, from his perspective, our relationship is complex. From my perspective, I love him and would do anything for him and only want what's best for him.
Yeah, that would be really hard for a mom. That's probably nothing could be much harder for a mom.
It was terrible.
To read those words.
It was heartbreaking.
Do you feel like a part of you understands why he felt that way now when you reflect on everything?
I do.
Okay.
I do. And I'm okay. He's allowed to have his feelings and I'm okay with it. I know in early recovery, I prayed for two things. One was peace of mind. I wanted to lose the obsession to use drugs because literally it's all I thought about. All I used to think about was where am I going to get the next one? And the next thing I wanted was to be the best mom to adult children that I could possibly be. And I believe that I have accomplished both of those.
That's huge.
It is for me.
It is. You made that happen.
Thank you.
First of all, what was it like for you to celebrate 10 years of sobriety?
Well, my actual date, my 10-year clean date is January 19th. But JD had made a statement at the RNC that he wanted to celebrate it in the White House. And I really didn't want to go to the White House. I'm working and I said, that's a promise that you don't have to keep that. We'll just say we did it. He would not let it go. Like, no, I want to bring you here. I want to bring your friends here. I want to do this. And so we finally ended up going. I think it was in April. And we did have a good time. And I got to take my friend Leslie, my family, people I went to meetings with. They all got to come and he made it very special. We celebrated in the Roosevelt Room. It was just amazing. He made it very special.
It's probably very meaningful to him and your entire family.
Yeah.
To have seen that day.
Yeah.
Given everything else that they saw. And
yeah.
Probably feared that it would never come or that you would never live to see it.
Well, he's made the statement that he didn't think he thought I would die in addiction. And I guess there was a time where I thought I would too. When I tell you that's all I thought about was getting high, that's all I thought. I was consumed with that.
Let's talk a bit about that, because I don't think most people who either haven't experienced it themselves or haven't been super close to someone experiencing it really understand what opioid addiction is like. So maybe you could take me through how you found opioids, how you became addicted, and like how that unfolded in your life.
Well, I was a nurse and I actually had a headache and took a Vicodin, and I have never felt so good in my entire life. I felt I had more confidence. I felt this huge sense of euphoria. I felt like I had found the answer to all my problems in that little pill. And my addiction took off immediately. Whatever was in that pill, I had to get more of. And that's what I did. And no high is as good as the first one, but you're always trying to reach that first high again. And your brain just won't let you. At least that's my experience.
The brain just starts to adapt to that substance, develop tolerance, just can't get there again. It's a biological phenomenon. But the memory of that rush, especially with opioids, is so powerful that it takes over.
Yes, ma'am. And it took over my life. And I quickly went from taking Vicodin to Percocet to then morphine. And then when I lost my job and my nursing license, then I had to resort to heroin. But it's all I thought about. Getting money to get it. Who do I know that's got it? How can I get it? It took over my entire life. It's the only thing that became important to me was getting more.
Is that because of how good it felt to use it, or is that because of how bad it felt when you were coming off of it?
Ooh, that's a very good question. Probably both. Because it did feel good for a few minutes, but coming off of it was terrible. For me personally, the withdrawal was like a prolonged flu. I had severe body aches. I've tried to describe my body aches to people, and the best way that I can describe them is imagine your leg is extended and somebody's got rubber bands up and down your leg, and they're twisting those rubber bands and twisting. And the more they twist, the harder, more the pain you have. And that's exactly how my withdrawals felt to me. I felt like my limbs were going to be cut off of me because they ached so bad. And the only thing that would make it better was to do it again. So
it's torture.
It was torture. I hated it. I wanted to never get to the point where I went through withdrawals. But of course, I did for a number of reasons. Number one, I didn't have the money to get more. We would have dry spells in our city where you couldn't find it.
So what'd you do?
Well, suffered the withdrawals or tried to get whatever I could. That's whenever you'd call your people that had Percocet or Vicodin or whatever opiate you could get, which it wasn't the same, but at least it prevented me from getting sick.
Yeah. And then that's what it unfolds into when a person gets severely addicted to opioids. It starts with chasing the high, but then it usually converts into avoiding that dreaded torment of the sickness.
And at the end of my addiction, I wasn't getting high anymore. But if I didn't have it, I literally couldn't get out of bed. I couldn't function. My brain, my whole body would shut down. And so I got it just to be able to get out of bed and move and avoid those body aches.
Did you ever inject it?
I learned this in treatment. I never put it in IV, but I did a thing called skin popping. That's what they called it in treatment, where I would just inject it sub-Q.
Just beneath the skin, but not into a vein.
Yeah.
Yep.
Because I was too scared. I was always afraid I was going to get hepatitis too. So I know I was.
You still had your nursing brain on.
Quite the contradiction. Yeah. So no, I didn't.
Now, some people do skin popping because it makes the high last for longer. Like generally the high is not as intense with skin popping as if you were to inject into a vein, but it lasts for a bit longer and helps people to prolong the period before they'll get sick. Did you take that mindset to it, or?
I didn't know that. I just knew that it was easy to get insulin syringes and turn the dope into liquid. So I did not know all that. that was just an effective way to get it in. That's it.
So how did you support this habit financially? Like, how did that work?
I did have menial jobs and, a lot of drug dealers, if you would have sex with them, they'd give you a hit. So I did what I had to do.
And at the time, what were you thinking?
This is my job. My job is to stay high. Yes. So you just numb everything and you're able to get high one more time.
So was there any point in time when you were reflecting on what you were doing to get high and thinking, how did I get here? Or did it like concern or worry you, or not really before you got clean?
I don't really think it did before I got clean. I just really, all I wanted to do was stay high. It got to the point at the end of my addiction where I didn't pray very often, but I would pray that God would let me go to sleep and not wake up because I was miserable and I hated myself and I hated my life and my kids weren't speaking to me. My parents were gone. I literally had nobody. And, I was kind of angry every time I would wake up because then I would have to go on the hunt again. So yeah.
So how long were you addicted to opioids? Like, how long did this go on for?
15 years, maybe.
With skin popping, sometimes people get skin infections and abscesses or cellulitis. Did anything like that happen to you?
No.
Maybe you cleaned your needles really well, and like the nursing.
Well, I wouldn't use a dirty needle, which I know I'd sleep with a stranger, but I wouldn't use a dirty needle. Make that make sense. But I had my standards, Dr. Glasner.
Did you encounter fentanyl?
I didn't. I think by the grace of God, I quit getting high before fentanyl at least hit my area. Because I think had I done that, I probably would be dead.
The way you were using it sounds like that could have happened very easily.
So I never did fentanyl. And I see a lot of fentanyl use now with my patients, and it's terrifying.
Do you find it relatable to what you went through, or does it feel like a whole other thing?
No, it's very relatable. It's very relatable. I just think it's a little bit harsher, and I think their withdrawals are a little bit harder than what mine was. Mm-hmm. But the mindset's still the same. They feel like they have to do it. That's all they're meant to do. And I felt like that's what I was supposed to be doing. So yeah, I think we have a lot more in common, just the difference of drugs.
Interesting. Well, an opioid is an opioid.
Right.
Some are more potent than others and some are more deadly than others, but they tend to drive behavior in similar ways.
Exactly.
Yeah. So at what point did you start to think about stopping?
Well, I'm not sure what drove me to want to stop, but I know that I was absolutely miserable and I hated my life. And I had some periods of clean time. And
how did you manage that?
Well, I'd been to treatment a few times. So it was outpatient. And once I went in inpatient, and I could stay clean for 6 months or a year, but I always ended up using again. I don't know what made me, but I did. And I had called a friend of mine from a little clubhouse in Middletown called Traditions Clubhouse and just told him that I wanted to die. And I felt like I needed treatment. And he said there was a care unit in Kentucky. And if I went, he could get me a bed. And I went. And that's the start of my recovery journey. That's the last time I went to treatment.
So the turning point for you was not wanting to live anymore?
I think so. Yeah.
Did you ever do anything to try and take your life or harm yourself?
No.
Did you ever overdose?
No, I may have. I know in the movie they said that I did, but that didn't happen. But one time I had got some drugs, and actually this was right before I got clean too, so maybe that's part of it. I had bought a whole bunch of drugs to celebrate my birthday, because my birthday's January 20th. My clean date's January 19th. And I used them, and I woke up on the bathroom floor completely naked 2 days later with vomit all over me. And I assumed that I had overdosed, but I didn't die. And I remember being in the shower and crying like, God, you almost did it. Why did you let me wake up? And that's when I called my friend. So it kind of all is in that same week, and just said, I've got to get help. I'm going to die. So he sent me to the care unit, and that's where it started.
Now, what about your family? What was happening between you and your family, and how were you acting towards your family during these years when you were...
They weren't talking to me. They wouldn't talk to me.
How far into your addiction did that start, that they stopped talking to you?
Well, after my mom passed, little by little, they started cutting me out. And probably within 6 months of her death, they were none speaking to me.
Were there certain events or turning points for them where they didn't want anything to do with you because a certain thing happened, or you did something when you were high?
Well, I did break into my sister's house and try to steal from her. So that may have been the turning point for her. And she probably shared it with the kids. And I think the kids were just really angry. Lindsay would occasionally talk to me, but it was very brief and very not like an ongoing conversation, just answering my questions and then saying she had to go.
Did that figure into it for you? Like, nobody's talking to me, or certain ways that they were treating you?
Yeah, I definitely wanted him in my life. And, in my drug-addled mind, I couldn't figure out why they were so angry. I just couldn't get it. It took me years to figure it out, but I thought, I don't know what's wrong with them. I guess it's just the way the drugs worked on my mind, but I just couldn't see my part in it.
What do you feel like the drugs were saying to you that like they should understand? I'm just addicted, poor me? Or was it more like nothing I've done is that bad?
Nothing I've done is that bad. I'm their mother. Their life wasn't that bad. They need to grow up. I'm not hurting them. That kind of stuff. Kind of what I was telling myself.
It sounds like you view that differently now. Now you see that there was hurt going on.
Oh, I absolutely view it differently today. I'm ashamed of myself. Got a lot of shame and guilt. I still carry it with me. So I just try to be the best I can today. I can't change what happened and what didn't happen. It just is what it is.
You have today and forward, and you've had the last 10 years to be more of the kind of person that
Exactly. Because I do go around a lot and share my testimony with different Celebrate Recoveries, churches, 12-step groups. And I told my daughter when I speak, I don't like the way I end, because when I end my talks, I say something like, I'm so blessed today. God's given me so much. And that just sounds so blah. And she said, well, you need to end it with something like, I'm just getting started. And so that's how I ended my last talk. And I said, oh, yeah, I love that. I'm just getting started. Even though I'm old, I'm still just getting started. So, yeah.
A lot ahead of you, potentially. You really do. Yeah.
Yeah.
So how many times in total did you have to go through treatment for it to stick?
Well, let's see. I went to 1 residential, 2 outpatient, and then the last one that I went to, it was a care unit, and then it was an outpatient, and I lived in their sober living or a sober living. So that one probably lasted about 18 months from start to finish.
And is that the one that stuck?
That's the one that stuck.
And treatment can take different forms, but especially for an addiction as severe as yours was, staying in an environment in some capacity for more than a year probably made a big difference.
It did. And I see that a lot in my working field. The longer people stay, the better the outcome seems to be.
What was the role of medication in your treatment?
I tried everything. I did everything. I had the Vivitrol injections. I did Suboxone. I did everything.
What worked?
Both. They both worked.
Vivitrol and Suboxone?
Both of them worked for me. And I think even today, if I got to a point where like I was having cravings and wanting to use again, I probably would reach out and get started on Suboxone.
Oh, Suboxone has turned so many lives around.
I think it's a lifesaver. And I see it save lives in my facility every day. And that's kind of a bit of an oxymoron, because I do go to 12-step meetings, and people in 12-step meetings say, if you're on Suboxone, you're not clean, because it does have a little bit of an opiate in it. And I always try to follow, and that I can see that person get so discouraged and walk out of the meeting. And I always try to follow him out and say, don't listen to that kid. He's not a doctor. He doesn't know. That's between you and your provider. And if this is working for you, then keep going and don't let anybody judge you.
We've been doing research at UCLA on destigmatizing Suboxone. A lot of that just stems from misunderstanding of what it is that medication like Suboxone does. It is opioid replacement, but if you think about the way in which it stabilizes the brain and prevents those highs and lows of using, withdrawing, needing to get more, and all of the things behaviorally that stem from that, stealing, overdosing, by providing that sort of steady state and preventing those highs and lows, people are able to get back to work, raise a family. It's life-saving and life transforming for a lot of people. And when the alternative you're looking at is the addictive behavior patterns, it's kind of a no-brainer.
I agree.
And there's also this limited understanding of the fact that there is this ceiling effect of Suboxone where you could keep taking more and it's not going to do anything. People don't really understand the pharmacodynamics of how Suboxone works. I'm so glad that it helped you to recover.
Yes, me too.
And it sounds like 4 attempts over how many years for you to get there?
Well, I guess 15. I went to outpatient twice, and then I went to a residential program for 30 days. And that time I was able to stay clean, I think between 9 and 12 months. But I didn't do anything that was suggested. I went to treatment and I was done. I didn't go to 12-step meetings. I didn't get a sponsor. I didn't get connected with anything that is recommended. And I did all of that this last time. I got a sponsor. I got connected with 12-step meetings. I don't think that's the only way that people can get clean and sober, though. Let me just state that for the record. I think that everybody has to find their own path of what works for them. But that's what worked for me at that time in my life.
I think that's an important takeaway as well, is that part of the reason that you probably had to try many different times is because you weren't totally committed or ready during some of those attempts. I don't know. Did some of them happen in response to family trying to put you in treatment, or did they all come like from you wanting to recover?
Well, they all came from me and getting in trouble with the law. And one of them was getting in trouble with my job. And the other two were just, I wanted to do it and thought that I needed help, but then I would forget that I'm a drug addict and use again. I don't know what I thought, honestly. I think maybe if I just used on a certain day or in the evening, but whatever I thought was wrong, because now I know I can't use anything. So that's the best way.
Yeah. So are you totally abstinent from all substances now?
Yes.
Like you don't drink?
I don't do anything. And I do have friends that are in recovery and they do drink. And they'll say, well, cocaine was my drug of choice. I don't do cocaine. And that's okay for them. But for me, I'm totally abstinent. I can't do anything. And I don't even want to take the chance. I don't think I had a problem with alcohol. I do remember drinking sometimes if I couldn't get my drug of choice because I didn't want to get sick or have those pains. And I would do anything to avoid that. But I also feel like it would diminish my inhibitions. And if I got a little bit of a buzz, I would think, well, screw it. I might as well do this because this is what I really want. And I'm not willing to take that chance.
Yeah. And that is the main risk when people ask me about, do I have to be totally sober? If my substance of choice is cannabis or if my substance of choice is opioids, do I really need to stop everything? Because that's a lot to wrap one's head around when they've lived a life of a lot of substance use. And also if they're just somebody who likes that feeling of a rush or a buzz.
Right. Yeah.
But it is exactly what you're describing, the way in which it primes the reward system to go, oh, I remember this.
Yeah.
This felt really good, and I know how to make it even better.
Right.
And then with your inhibitions lowered, you might not make the same judgment call as you would if you hadn't dabbled in the alcohol. So, but that's interesting because you have this very strong genetic kind of vulnerability to alcoholism, and it sounds like it didn't click with your body.
No, I don't remember ever having trouble with alcohol. I never had any DUIs. I never got into any legal troubles surrounded by alcohol. It was always the opiates that got me into trouble. But I do remember when I drank too much. And I would definitely drink. I didn't drink because I liked the taste. I would drink to get drunk.
And did it take you a lot to get drunk?
Yes.
Like from an early period of time?
Yes, I do. I remember thinking I could drink anybody under the table. You know, I don't know if that's a sign of having an addiction, but yeah, I never. Is it? Okay.
Yeah. So there is this
for me to get drunk.
Yeah. That is something to watch out for in terms of risk factors, because there have been studies about a person's responsivity to alcohol. And if you have like a low responsivity to alcohol, meaning that it takes a lot for you even when you're first exposed to alcohol to really feel anything, it's a marker of addiction vulnerability.
Oh, okay.
So that was there for you.
Yeah, that was there. That's me.
I want to come back to something that we talked about a little bit before about enabling that went on in your life and in your family. First of all, in the Hillbilly Elegy movie, there is this one scene where your character asks JD to pee in a cup for you because you're working a job, need to demonstrate that you're clean and sober. He refuses and becomes very emotional and says, you should have thought of that before you decided to use. I'm not doing that. And then Mama comes in and says, what's going on? And she says, JD, you have to do this for your mother. What I'd love to learn more about is your perspective now on the other side of your addiction as a nurse practicing in the field. If you had a family sitting in front of you saying, is it wrong to help someone with an addiction to keep their job? They're not being perfect in their recovery, to do something like was Mama wrong to insist that he provide that for you? Or was she right? Did that help you to function and maybe be a little more motivated in your recovery?
Now my perspective is completely changed. For me personally, I had to be helped down to get help. I had to hit my bottom. And everybody has a different bottom. And that just prolonged me hitting my bottom. Yeah, it might have saved me that day or until the next urine drug screen. However, I eventually got caught because I'm an addict and I couldn't hold it together. And the alternative is, do I think that Mom did wrong? No, she was trying to help me. That actually did happen in real life, by the way. They didn't dramatize that. So she was thinking of me keeping my job, me keeping my nursing license. She probably was enabling me, but in her mind, she really thought she was doing the right thing. Now, today, I would tell a family member, don't do it. You're not helping them. You're only prolonging. They will get caught. Maybe not today, but eventually. And they might just die in between today and the time they get caught. But at that point in my life, I couldn't have heard that at all. But that would be, yeah, my viewpoint on that has completely changed. And another thing, I'm really embarrassed that I involved my kid, got my kid to do that. But again, in active addiction, we're very selfish. All we think about is our needs and what we need. We don't think about anybody else. We think about what's going to get us the next one, what's going to help us keep that feeling. And that's exactly what I was thinking, was get me through this and I'll clean it up. That's what I said. That's not obviously what I was thinking, because I didn't think that. But yeah, so, oh yeah, my viewpoint's changed on that 100%.
It sounds like you definitely, from your life experience, bought into the concept of rock bottom, because not everybody buys into that. Like, do you really need to let people hit bottom? It sounds like you feel pretty strongly that you do.
Absolutely. I think if you're an addict like I'm an addict, you have to hit rock bottom or you're not going to quit. You either have to hit rock bottom or you're going to die. There's no in between.
As we've been talking, your description of all the things that motivated you to ultimately stop using opioids sound like they fall into that very severe negative consequences, rock bottom kind of category. You talked about legal problems. You talked about your family not talking to you anymore and shutting you out. You talked about wanting to die, overdosing, and your mom wasn't in the picture when she had already passed away. When you reached that point, you feel like as long as she was alive, she wasn't going to let you hit bottom?
Absolutely. Absolutely. I love her so much. She was very ill and she had pain pills prescribed, and she would give me 3 Vicodin a day because in her mind, that would keep me off of the street. That just gave me enough energy to go out on the hunt. And I would take those, and then she would go to sleep and I would steal whatever she had left that I could find that she didn't hide from me. And in my mind, I needed them more than she did. And like I said, I have a lot of guilt and shame still to this day, but I want to be authentic and I want to be honest. And that's what I did. That was another one of the things that I did, was I stole drugs from my mom, who legitimately had them prescribed. I didn't.
Well, I think you hear that very commonly in people's stories of addiction, is that they stole drugs from other people, but you don't hear the overall context from the person who was doing it as far as what was motivating it and this sort of physiological and psychological desperation that goes into that.
That's a good word, desperation. I had to have it. It was a feeling of desperation.
Another probably rock bottom-ish moment that was portrayed in the film was this scene that in the book, J.D. Vance describes as probably the scariest experience of his life, where he was in the car with you. You got very upset. You started driving erratically and saying you were going to kill both of you. Well, that you didn't want to live and maybe you would just drive the car into something or off with something. And then after that, the police were involved and you ended up getting arrested. Was that the right outcome, or did some enabling play in there as well?
Oh, definitely enabling. That scene was partially true, partially dramatized. There was not a lady. He didn't run into a lady's house. I did speed the car up and say that I was going to wreck. I got pulled over. I had drugs on me. So the police searched me. I was arrested for drug possession and child endangerment for driving and having a child in the car. They called my mom and dad to come and get JD because I was going to jail. So, of course, my mom and dad and Lindsay showed up to get JD. I went to jail. I had these unmarked, I believe it was Percocet in my purse. But I called a doctor friend that I knew and I said, please say you prescribed me Percocet. And he said, but I didn't. And I said, I'll explain everything later. Just say you prescribed me Percocet. And he said, okay. And I put him on the phone and he said, I prescribed her Percocet. So the drug charge went away. The possession charge went away. But I still had the child endangerment charge and I had to go to parenting classes, which was a waste of time because they were geared towards infants and toddlers. And my kids were teenagers. But I attended them because I had that child endangerment charge. Children's Services got involved, and that was actually their punishment for me, was to attend the parenting classes. But there was no follow-up drug screens. You know, my doctor friend said he had prescribed the Percocet. That charge was completely gone. So there was definitely enabling, and it just bought me more time to keep doing what I was doing.
Why did your doctor friend do that for you? Were you guys really good friends, or?
We were pretty good friends, I guess. I mean, I didn't say I'm a drug addict, and I just said I had a few Percocet from a toothache or whatever, and I got pulled over, and the cops found him, and I'm sure I made up some believable lie because he bought it. But yeah, he did it. We worked together.
Addiction can make you a master manipulator.
Oh, I was the best. Yes, I was so good at it. And yeah, I don't even remember what lie I came up with to manipulate him, but he took care of it. So I just didn't need an additional charge.
Right.
So,
but you did need it.
But I did need it. Exactly. Right. Exactly. It might have helped me hit rock bottom sooner, but it wasn't meant to be, I guess.
Do you have any advice for families of someone who's as addicted as you were, or maybe even not as addicted, but someone who's clearly addicted, who are watching this interview and thinking, oh, that's me. I'm enabling my kid, mom, whoever it is, but I'm really scared to just let go.
I can't imagine having a kid that's addicted because I don't know how hard I could be on them. But my advice would be, no matter how hard it is, you've got to stop doing anything for them. Don't give them a place to stay. Don't give them any money. Tell them you're not going to talk to them until they get their act together. I don't know if I could do it, honestly. But that would be my advice, because the alternative is, and people are dying out there every day, and the drugs out there, they hit different than when I was using them. And I think we see a lot more deaths than we did back when I got clean. And it's probably because of the fentanyl. I know it would be really hard to do, and I don't even know if I could do it. I actually have a young lady that's reaching out to me on social media, and her brother is addicted. She's letting him live in a tent in her backyard, and he's refusing to go to treatment. I just said, you're not helping him. You're doing that for yourself so that you can say, I'm helping my brother. You need to tell him to pack his tent and get out. She said, I can't do that. And I get it. I don't know if I could do it. But as long as he's got a place to pitch his tent, I don't think he's going to get clean and sober.
Let's talk a little bit about your son's book, Hillbilly Elegy, and what it was like for you when he released it. I understand that even though it had some tough things in there about his upbringing with you, that you were very supportive of him despite that.
I was very supportive. He actually came to a 12-step meeting that I was attending and said that he wanted to talk to me after the meeting. And then he said, Mom, I wrote a book and you're not very favorable in the book, but I honestly didn't think you'd be here. I didn't think you'd be alive and clean and sober. And if you want, I'll cancel it. I just will cancel the whole thing and not have the publishing go through. And I just said, will it help you heal? And he said, yes. And I said, publish it. Let's do it. And it was more heartbreaking to actually read it. I didn't really know that's how he felt. I didn't know he had so much anger. But I think looking back, it has given us some healing. And then the movie coming out helped us heal a little bit more, helped him heal a little bit more. So everything happens for a reason.
Well, this sounds like the recovered you. Like you've described yourself in our interview today a few times as selfish, at least in the course of your addiction. But that couldn't be more selfless, to allow the very worst of yourself to be showcased to whoever would read or watch about it.
Well, thank you very much. I mean, I'm not ashamed of being a drug addict. I am a drug addict, and hopefully somebody will see it or read it and think, wow, if she can do it with all the crap she's done, maybe I can do it, or my sister can do it, or my brother, or whoever. And that, I feel like, has become my mission.
Oh, that is inspiring.
Yeah, I'm blessed. I'm very blessed.
And this is sort of a generational issue, right? So your father was severely addicted to alcohol. Does it go back further than that? Were your parents' addicted to anything that you know of?
I'm not really sure. I think maybe my mom's dad may have been addicted, but I don't know that for sure. And Dad's dad died when my grandmother was pregnant with him, and I know she wasn't addicted, so I'm not sure. I just know that Dad and then me, and I hope it ends with me. I know neither one of my kids are addicted. I don't think my grandchildren are. 3 of them are still too tiny to realize that yet, and the other 3, I do try to keep an open dialect with them about it. You know, try to make them be conscientious of their alcohol and substance use so that they know that they are definitely genetically dispositioned to have this.
Yeah, we know that 40 to 60% of it is genetically influenced. So they have strong genetic influences, but that
Is that high? I had no idea. That's crazy.
Is there something that you want for your grandchildren to take from your story in particular and carry with them?
To know that they do have this genetic predisposition, and if I could have my way, don't partake. Don't even find out if you're prone to this. That would be my best advice.
Well, not drinking is trending now. It is becoming a thing in this generation, in the youth of today who are drinking age. There's like a lot of health buzz around mocktails and alternatives to drinking. And there's research studies coming out saying that all those studies that used to say drinking wine every day was good for your heart have been essentially discredited in ways, and that no amount of alcohol is really healthy. Is any amount of alcohol harmful? I think that's debated, but there's now studies linking alcohol to various types of cancers. I mean, it reminds me a little bit of the evolution of our understanding of the risks of smoking. Smoking used to be very widely accepted socially in the way that alcohol is and was. But after we learned more about lung cancer and just how lethal smoking can be and how impactful on health, a lot of people, smoking wasn't in anymore in the same way. I feel like we're a few steps away from alcohol is out. I don't know that it's out, but not drinking and drinking mocktails is in. And it opens up interesting possibilities for your grandchildren to maybe not go there.
Yes, and that's what I will tell them, to avoid its substances, because they could be the one that it takes off with and it ruins their life. And I would also tell them, if they do find that they have an issue, that I am here and I will do anything that I can to help them stop. I won't help them continue. I'll help them stop.
Yeah. True to your values and your learnings from your own addiction. You won't enable them. You will help them to stop. That makes a lot of sense. So you said that there were some things that you realized you didn't remember them the same ways, or you didn't know he felt certain ways. Are there any specifics that jump out in your mind of things that you've been able to clarify as a result of him writing his book, producing the movie?
Not really. I didn't think that I was that bad, because I guess in my mind, I wasn't as bad as my dad. But from their perspective, I'm their mother. And I think it is a little different if it's your mom than if it's your dad. And I'm really the only person they had, because neither one had their dad living in the house. And there was always a different person. So I should have been their safe space. And I know I wasn't. But I want to be now. And I want them both to know that I'm here. I love them more than anything. And I think we're healing. And I guess there's always more healing that can be done. Not on my end, from JD's end and from Lindsay's end. But on my end, I just want to be here and let them know that I'm here and I love them, and I'll do whatever I can to make them feel safe and know that they are safe and that I'm not going to do anything to hurt them.
How confident do you feel that you'll never pick up drugs again?
Well, I'm an idiot if I would say I'm never going to use again, but I'm not going to use today.
Why are you an idiot if you say that? I think a lot of people who aren't in the recovery space themselves would not understand why you would say that.
Because I don't know what tomorrow holds. I know that I'm not going to use today. And I mean, in the 12-step recovery, which is the way I got clean and sober, we say we're not going to use just for today. And I'm pretty confident I'm not going to use again. It's not like I have an intention to, but I don't want to be arrogant or cocky and say, oh, I'm never going to use, but I'm not going to get high today. I know that. So it's just the way we talk in Narcotics Anonymous.
Yeah. Yeah. It's one day at a time.
One day at a time. Right.
So Mamaw was played by Glenn Close.
Yes.
You were played by Amy Adams.
Yes.
Who has been nominated multiple times for Academy Awards and won Golden Globes and even received a nomination from the Screen Actors Guild for an award for her portrayal of you.
Yes.
What was that like?
It was a lot of fun. The making of the movie was fun. I remember when JD reached out to me and said that the book was going to be a movie, and several people had approached him about making it into a movie. And he wanted to go with Ron Howard because Ron Howard was going to make it a family story and about redemption and recovery and a family's love. And then when he told me that Amy Adams has who they chose to play me, and I thought, wow, because she played Lois Lane in the Superman movie, and I thought, she can play Lois Lane, I guess she can play me. But we spent time with the actors, and they had a dialect coach come in because I guess here in Ohio we have an accent. I didn't know we did.
I hear it.
But the dialect coach came in and spent time with us, and then went to Kentucky and coached the actors, and I thought Amy Adams was amazing. Ron Howard took everybody out to dinner, and she's beautiful and articulate and spoke about her daughter, spoke about her husband. And, I just really liked her. And of course, we all loved Glenn because Glenn wanted to look like Mom. And she actually wore Mom's glasses in the filming of the movie.
Did she really?
Yes, she did. And she really pulled it off. She really did resemble her.
Well, what about you? Did you feel like she got you and your essence, Amy Adams, and the way that she portrayed your character?
I did. I absolutely did. Yeah. A little sarcastic, but I always thought I was doing the best, even if I wasn't. And, that no matter what, I did love my kids. Even through my addiction, I always loved them a lot. And I think she got that.
Yeah.
Yes.
Yeah, that came through.
Yeah, I think so too.
That you were trying. You were trying to provide a life for them.
Yes.
That's what I was thinking earlier, was in your description of the way that you're building trust and a relationship with your entire family and your healing. I think that's one of the toughest parts of recovery, is that sometimes there's been so much damage done, and people with addictions tend to like immediate gratification. That's partly by definition what propels you or moves you in the direction of substance use. But this can be one of the slowest things to change, and you have to have a certain patience. I think faith, as you've mentioned your faith many times, and that seems to play a role. Willingness to kind of sit through a lot of discomfort in the rebuilding process. Like you described a lot of shame and guilt. Sounds like it's been a very big part of your recovery, is rebuilding these relationships and sitting with the slowness of that and the challenges.
Well, I got a text yesterday or the day before that said, JD and the kids are coming into town next weekend. They want you to be available. They miss you. And I said, of course I'll be available. And basically what that translates to is that JD and the kids are coming into town and JD's got plans. He'll need you to babysit. It was from his secretary. So I reached out to my sister and I said, JD and the kids are coming into town next weekend. And she said, oh, I won't be in town. And I said, well, where are you going to be? And she said, I'm going to Connecticut. Our cousin and her husband are having their 40th wedding anniversary, and there's a big party. And I said, oh, my invitation must have got lost in the mail. And my sister just replied, ha ha. But I still do get a lot of that. Like, I don't get invited to cousin things. And I still think it's because in their mindset, I'm still the drug addict that either can't afford to come or won't come, or they don't want me there. It does hurt my feelings a little bit that I still get put out of those things. I wouldn't go now because I would rather be with my son and grandkids. Those things still do happen. Not with my kids directly. I get invited to everything they host now, whereas I didn't before. But I still get, left out of some of those other family things.
Yeah. Well, some people are not willing to rebuild the trust. Like some relationships get lost, and that's painful because those members of the family are fixated likely on a prior version of you, but they either aren't aware of the current version of you or they're just not willing to have faith in that version of you sticking around, so they don't want to face the pain of the potential disappointment.
Well, whatever the reason, it's their loss because I'm very charming.
That's right. That party would have been much more fun with you there.
That's right. Thank you.
So the book and the movie were like a little primer in terms of public attention to what was to come next. So I can only imagine that your life must have changed overnight when JD became the Republican nominee for vice president. What was that like for you?
Well, it did change a little bit. So at the RNC, there's a part in his speech where he says, my mom is here tonight, 10 years clean and sober. And what people don't know is earlier in the day, he sent me that part of his speech and said, this is part of my speech tonight. If you don't want me to say it, I won't. And I said, why wouldn't I want you to say it? Everybody already knows I'm a drug addict. And he said, Mom, maybe a couple 100,000 people know you're a drug addict. They're expecting 4 million people to tune into this thing tonight. And I just said, go ahead and say it. I'm okay with it. But he did ask me, and I feel like I've been given a really good platform to let people know that recovery is possible. And I try to be very honest about my addiction and that I wasn't one of these drug addicts that didn't break the law, didn't abuse my body, didn't lie and cheat and steal. I did whatever I had to do to get the next one. And I have been asked to speak a lot. I've been invited to your podcast. Thank you for having me. And I speak about twice a month now, going to different places, different churches, celebrate recoveries, 12-step meetings, a lot of women's ministry. So I'm very blessed because I hope I can instill hope in some people and let them know that recovery is possible. And being on this side of recovery is so amazing. It's amazing to get up every day. And like I used to get up and the first thing I thought was, who do I have to sleep with today? Who do I have to manipulate today? Now, the first thing I get up and I think of is, I wonder if Belle feels like taking a walk this morning. Belle is my dog. And that's such a good feeling. You know what I'm saying?
Yeah.
And I know I say I'm blessed a lot, but I really am blessed. And I just couldn't imagine my life getting any better.
Your life has meaning and purpose now.
It does. Oh, I take that back. I could imagine my life getting better. If I get off contract with complete restrictions with the Ohio Board of Nursing, that will get better.
That's next. That's next. I have faith that that's next. You've mentioned faith a lot. Can you talk a little bit about your spirituality and how that has changed over the course of your life?
Yeah. So I never felt like I was a religious person at all. But the 12 steps are based off of the Bible. And I've been asked to go to a few of these celebrate recoveries, and they get clean and sober with just prayer. And they go to one meeting a week. And then I was recently asked to go to a place in Arkansas called John 3:16 Ministry. And they are based off of prayer and work. And the people have a purpose. And I just think there's so many different ways that people get clean and sober. And in my narrow-minded thought pattern, it was just through the 12 steps and groups. And that's not true. People get clean and sober any number of ways. And I just find that I really talk to God a lot and just ask him where I should be, what I should do. And when I'm completely still, I can hear the answer.
That's amazing.
Thank you.
Do you go to church?
I do not. I've thought about maybe going to church, maybe shopping around a little bit, but it's a process. I haven't done that yet.
Were you raised going to church?
Absolutely not.
Oh,
we were not raised in church at all. No. Now, my mom definitely believed in God. One of the things Dad would say when he was very drunk was that he was God. There was no God. He was God. So I kind of grew up really hating God because it's like I felt like God was mean.
Yeah.
But I know today that my God isn't mean. And then when my mom passed away, we found all these journals of prayers that she had written. And some of them were pretty specific, like to my daughter, Beverly. So she wasn't as open with her spirituality because she didn't want to provoke Dad, but it was always there. And some of them are beautiful. As a matter of fact, JD has framed one and has it in his bathroom at his house. One of my mom's prayers. Yes.
So do your children go to church, or are they similar in spirituality to
They
you?
actually do. JD converted to Catholicism, and Lindsay goes to a non-denominational church, and then their kids all go to church. So that's kind of another area where the cycle's been broken. And I have learned a lot. I think that a child probably should be brought up with some form of religion. So when they struggle, they may at least have a place to feel like they can fall back on.
The community.
Yeah, a community.
Yeah.
Yes.
Yeah. And it sounds like you found a nice community in recovery.
I have. And I think I'm at a point where I kind of want to walk away from the 12 steps and maybe join a Celebrate Recovery group.
Yeah, you're ready for a transition of mindset.
Absolutely.
And you're in a different stage of recovery now. So it makes sense that you might be in a different stage of recovery support.
Yes. But I'm kind of learning how much prayer and the presence of God is, how important that is in recovery. And at least for me personally.
Yeah. Well, actually, studies show that also, is that spirituality ties to treatment outcomes. So people have like stronger sense of spirituality and faith in whatever form that takes.
Oh, wow. I didn't know that.
Better. Yeah. So that's probably playing a role in your success.
So now that I have your phone number, I'll probably call you a lot and pick your brain about stuff.
Pick away. I saw something written about you that you had to like go off of social media for a period of time. I don't know if that was like accurate reporting or not, but I saw it in an article somewhere. Was the social and other media attention positive after JD became the Republican nominee, or did you face criticism?
It was negative. There was some criticism, and there were people like saying things on social media, have her pee in a cup, just stupid crap like that. And I just found it hurtful, and I just chose to walk away. And
was the have her pee in the cup, was that after your recovery was celebrated, or that was just during his campaign?
That was during the campaign. Yeah.
Really?
It was after the RNC. And then people were like, oh, if she's 10 years clean and sober, have her pee in a cup. And it's, dude, I'll pee in a cup for you, but you're going to pay for it because it's clean. You know what I'm saying? I'm not giving it away today. So.
Yeah. Well, did that affect your recovery? Because, recovery
it really
has ups and downs, and that could be.
It just kind of made me mad. So I said I was going to step away from social media and not let it bother my peace, because I can create my own peace within my own little area. So I don't need strokes on social media. Those people don't even know me.
I think that's really important to keep a sense of separation, because people say all kinds of things
yes.
on social media. And if you're super tied into it or tuned into it, it can be really impactful in a way.
I agree. And I'm not that into it. I do have Facebook, but I mainly just go through and like a bunch of things. I don't post that much, but I do like to uplift other people and like what they post, especially if they post pictures of kids or grandkids and
right.
stuff like that.
Yeah, you're in it for the positive parts.
Exactly.
Yeah.
Exactly.
So it made you angry, but it doesn't sound like the anger that you experienced was affecting your well-being or your recovery.
No, I won't let it. And I've got the tools today to know how to not let it.
Yeah. How do you do that?
Well, I knew that if I stayed on that, I would get angrier. So I just exited social media and talked about it with a few people. And then we turned it into a joke. And, there were some other negative comments too. I can't remember what those are right now. But basically what everybody said is these are people that don't know you, probably don't even live here locally. And that's their, they basically hide behind a keyboard and want to make people miserable. And I'm not going to let them make me miserable today.
Yeah. Well,
self-talk, I guess. Positive self-talk is how I did it.
But it's also another kind of element of addiction treatment, which is knowing your triggers and avoiding them rather than trying to be strong and expose yourself to certain things that may be triggering. In this case, it makes you angry. Those negative feelings probably aren't great for your recovery, even if they're not triggering you to want to use necessarily, but you don't need to lean into those triggers. You can just disengage from them. And that's disengaging from social media, which to me sounds very healthy.
Exactly. I agree.
What about the public celebration of it? Did that trigger any kind of public reactions or reactions in your community or this White House celebration?
If it did I didn't pay attention. I just went and had fun, got to spend time with my son and his family, and come home, and I didn't even engage. Yeah. I'm sure there were some negative comments out there, but I didn't see them.
It sounds like you are out there starting to speak increasingly now, but I think this is the first time that from beginning to now that you've shared this depth of your story.
I agree.
So why now?
Because you asked me and it felt right.
It's the right time for you.
It's the right time. Yes.
Yeah.
And you're very easy to talk to. You made this very easy.
So glad. Okay, so I would like to talk a little bit about your sort of psychological well-being and go back to your relationships a little bit. Sometimes there's underlying psychological difficulties that lead people to develop addictions. And you've definitely described a difficult upbringing with Mama and Papa and all that was unfolding in your household and the nights you had to spend sleeping outside of the house. And I imagine you had to go to school after that. But something you haven't really described is, did that impact you psychologically in a way? Do you feel like there was something on the mental health spectrum that was going on that might have triggered you to become addicted in the way that you did?
I don't think so. I always thought that I was crazy. I thought that I was bipolar or something was wrong with me. But in hindsight, I don't think so. I think I was a drug addict. And I was able to compartmentalize everything, if that makes sense. I would compartmentalize Dad being abusive. And then the next morning I would go to school, it just didn't happen. That just wasn't part of the school day. And then when I'd go home in the evening, I didn't really get afraid until we were going to bed and the bars would be closing. That's whenever we would have to evacuate the house or do whatever, was when the bars closed. So it would be getting woken up out of a sound sleep just to go somewhere and hide. It was insane. but I don't think I had any underlying psychiatric problems. I've been diagnosed with being bipolar. That was all back when I was using.
Yeah.
Because now that I'm clean and sober, the only thing that I take is buspirone for anxiety. And I don't even think I need that, except for my doctor said, well, have you had any panic attacks in 3 years? And I said, no. And he said, that's maybe because the buspirone is working. So let's just keep taking it. So I said, okay, that makes sense. Because it doesn't make me feel any way, one way or another.
It's pretty benign.
Yeah.
Yeah. So anxiety was a thing. You were having panic attacks at one point.
I thought twice I was having a heart attack. And I went to the hospital and my heart was fine. And they said, well, they didn't say it because they said they're not allowed to, but one of the nurses had said, I think you're suffering from some panic. And then I reached out to a psychiatrist. And
was that when you were using or when you were?
When I was clean. It's when I was clean and sober.
Okay. Yeah. Was there anything going on at that time of your life that was feeling out of your control that might have had you feeling panicky?
I can't really remember specifically, just life, but because it happened twice and I had to go to the ER.
Very common, by the way.
And they were very close together. Yeah.
Because they feel like you're actually having a heart attack.
I thought I was having a heart attack.
Yeah. Yeah. That's super common. Glad that buspirone got that under control.
Mm-hmm.
Let's talk a little bit about your relationships. So most people can't say they've been married 5 times. So let's talk about that a little bit. What do you feel like that was about? And how do you feel like that impacted your children?
Well, I think it negatively impacted my children. And I think maybe drugs wasn't my only addiction. Maybe I was addicted to men too, because there was a period in my life where I couldn't stand to be alone. I had to have a partner and I didn't have a great picker, but I haven't really figured out what that was about. But every time I got married, I knew it wasn't a forever thing. I'm made different than I think normal people in that area. I don't have a forever commitment. My forever commitment is with my children and my grandchildren. Those are my forever people. And that's just how I feel.
Do you think that had something to do with what you saw transpire between your parents? Because you described this sort of like numbing. So that was obviously processed by your brain as something that was traumatic in a sense, traumatic enough for your brain to want to forget a lot of it.
Yeah.
Do you think there was something frightening about commitment when you saw the one role model that you had really of a forever commitment had a lot of pain attached to it?
At the front of my mind, I never thought that, but since you're asking, maybe in my subconscious, I think that really makes sense. Yeah, I never really understood that before this very second, but yeah, I think that makes a lot of sense.
What about your kids? Did they feel attached in any way to any of the men who you were married to as a father figure, or was Papa really the only father figure they had?
Well, I think that Lindsay has a dad, and she's very close actually to her father. And then JD had a dad, and even though they separated before his dad passed, they were able to reconnect and build some sort of a relationship. But other than that, no, they weren't really close to any of them. The third husband, so JD was born James Donald Bowman, and his dad was my second husband. And then whenever he walked away, I married a guy with the last name of Hamill. So I changed JD's name. I changed it, not him, to James David, because he's always went by JD. So the Donald and the David. So to James David Hamill. And then he went all through school as James David Hamill. And then when he graduated from Yale, he said he was going to change his name and he was going to take the name of the man that he felt was his father. And that was my father, Vance. So he just changed the Hamill to Vance because he was already James David. So his name is James David Vance.
So that's the origin of his name.
So I'm the one, my drug-addled mind did all the name changing, not him.
And then you became Aikins.
That is my fifth husband's name, Aikins. And I just kept everything. My nursing license is under that, and I kept it. I had all their names, but yeah, I just kept it.
I see. Okay. What would you say, just in getting to know you as a person? You've mentioned a lot of different kind of values. I think your family's coming up the most, and your sobriety. But what would you say is the most important thing to you in life, and how has that changed over time?
Obviously, family is very important to me. peace of mind and safety is very important to me. And I guess how that's changed is I never felt like I had any control over that. And today I know that I am in complete control of everything. Everything that has to do with me, I'm in control of. And that's kind of an energizing, positive feeling.
What's your view of that whole thing of addiction as a choice and all of that?
I see both sides. I really do. I think, and I'm just talking about myself here, but I chose the first time to take a pill. But after I took that pill, something in my brain changed. I felt it immediately. Like I told you before, I felt more alive. I had more self-confidence, more energy. Everything around me, the colors got brighter. Everything in my brain woke up. The choice was then gone. I had to get more of that. I didn't care who I had to hurt, even if it hurt myself. I had to get that feeling again. So I see both sides. I had a choice that first time, but after that first time, the choice was gone. I no longer had the choice. I had to do it. Does that make sense to you?
Yeah, because a lot of what you say through your lens of your personal experience maps right on to how we understand addiction scientifically, is that, sure, it's choice behavior. And in the beginning, some people choose it because it feels amazing, like you described. Mm-hmm. Some people choose it. And that's why I asked you a little bit about mental health, because it helps make something painful go away. In your case, I think you were more enjoying the rush.
Mm-hmm.
And then over time, the more people use it, the more impaired their decision making and judgment and reasoning capabilities become. And then once that transition has occurred, the choice behavior is impaired. It starts as a rational choice. And at some point, the drug impairs your ability to make rational choices.
Yes.
And it sounds like you have the subjective experience of that transition, but that transition for you happened very fast.
Yes, it did.
What do you think is the most misunderstood aspect of addiction?
Well, I think what's most misunderstood is that people that don't use, they think that we want to hurt our family or we want to hurt the people that we love. And we don't. We just don't feel like we have a choice. We have to have the substance no matter what. And if I have to hurt you in the process of doing that, then that's what I have to do, because I need this to survive. And that's such a strong feeling. It just is. And that's probably the most misunderstood thing I think about addiction.
So how would you change it if you could? Would you tell a family, you have to understand that's a different person that's been basically overcome by the effects of substances on their brain?
Yes, I would. That's exactly what I do. I tell families this is not who they are. You have to give them some time and step away. Sometimes the family has to step away to help the addict and to help themselves.
Yeah, so let's talk a little bit about your life as a nurse working in the field. It sounds like it's been very impactful for you in your recovery, just giving that hope and support to people who are seeking to recover from addiction. It's obviously a big piece of you and who you are. So if you had one message for people who are watching this interview, what would it be?
Well, treatment is available, readily available. And if you or someone that you love is suffering from addiction, reach out. Reach out to a treatment center, reach out to a 12-step group, reach out to a Celebrate Recovery, reach out to a church. There are several different avenues, and one of them will work. You just have to find it.
Yeah, that is also one of my important messages in general. Treatment works, but everyone's path and their time course to that outcome is different.
Yes.
For you, it took 4 times. For your dad, it took 1 time.
Yes.
Probably if you put you and your dad stood together and somebody knew both of your stories, they wouldn't think that he would recover after 1 time.
No.
Is there anything that you feel like people misunderstand about you?
No, I don't think so. I live a pretty simple life. I like my life. I try to spend as much time as I can with my grandkids and talk to my kids as much as I can. I have a dog. She's a senior dog, and she takes up a big part of my life. I go to work, come home. I get to come and talk to people about recovery, and that's really my life.
I feel like we hit on so many really important themes today. The fact that addiction is largely genetic, the way that it can impact one's behavior and take them outside of their persona, the intergenerational nature of addiction and how you've taken the first step to breaking that generational pattern. And then finally, very importantly, the fact that treatment works. You're a testament to that. The fact that you, like many others, were able to build a fulfilling and meaningful life and find stability and good mental health in recovery. So I thank you so much for sharing your personal story with me today and with everyone listening to the Dr. Suzette Glasner podcast.
Thank you, Dr. Glasner, for having me. It's been really fun.
Thanks for watching today. If you'd like to learn more, check out the links in my description to sign up for my newsletter and get a copy of my book, Addiction: What Everyone Needs to Know. I'll see you next time.